It is important to mark World Diabetes Day to create awareness about the disease and to let the community or the public know that this is a non-communicable disease and can be managed and people can lead normal lives with it. I am Edna Omondi, a nursing officer and a diabetic educator at Mwai Kibaki Hospital. The three cardinal signs of diabetes are usually excessive thirst, excessive hunger, and frequent urination. Risk factors for diabetes are family history, lifestyle, that is sedentary lifestyle, lack of exercise, and poor diet.
And today I have come to give you a very important message. Do you know your blood sugar? Well, you should, because diabetes is one of the leading causes of kidney problems, heart problems, and strokes in Kenya. And it is also one of the leading causes of amputations. People are losing their limbs because of diabetes. My name is Dr. Hilda Nabiswa, and I work in the endocrinology department of Mwai Kibaki Hospital in Othaya. So how can you prevent these complications? If you are already living with diabetes, it is very important that every year you get your eyes checked. Every time you go to clinic, ensure that at least 3 times in a year the doctor has seen your legs and examined them to make sure that the blood circulation is still good. Also make sure that you have a heart test done on you if you have diabetes or high blood pressure or both. And ensure that you have a test called HbA1c every 3 to 6 months. That is a test that will look at the control of your blood sugar and then will also help guide us so that we know which best medications to give you. If you are on oral medication and your HbA1c is still high, then we will consider giving you insulin. Do not fear insulin. It is a medication like any other, and it is very important because it will make your blood sugar go low and therefore reduce your chances of complications. So remember, if you're living with diabetes, whether it is type 1 or type 2, make sure you get screened. And that is why on 12th of November, we are having a camp that will help us to screen all the people living with diabetes for eye complications, for nerve complications, and also examine their lungs and heart to ensure that everything else is okay. So make sure you turn up if you are around Othaya, but also wherever you are, you can celebrate that day by going to the nearest health center, going to the nearest hospital near you, and get your tests done.
The effect of diabetes, diabetes is a disease that usually affects most of the systemic areas in our bodies, and the main area that is also affected is the eye. Number one, patient can present with loss of enough tears, that is called eye dryness. Then also they can also develop cataracts, or the lens becomes opacified. They can also develop some bleeding or hemorrhages in the retina, and they complicate with something usually called diabetic retinopathy. I'm Catherine Mwikali, an ophthalmic clinical officer stroke cataract surgeon working in Mwai Kibaki Hospital, Kenyatta. For eye complication, for example, for dryness, we usually give lubricants and artificial tears and supplements for the tears. And also for cataracts, we usually do cataract surgery. And for diabetic retinopathy, it depends with the staging. Number one, the main control is to control diabetes and control sugars. Make sure that the sugars are well controlled, at least less than 10, usually okay, but 7.7 is the most accurate control that we usually require. Again, we also do something we call intravitreal injections, like we usually inject a drug by the name Avastin or Lucentis. Those they prevent the microaneurysm and bleeding from the retina. We also do laser. Laser is usually done to stop the bleedings from the microaneurysms and stop the patient from becoming blind also. We can also do vitrectomy, more so when the vitreous has some hemorrhages. We just remove the vitreous, and that can help the vision of the patient. Normally, diabetic retinopathy is usually asymptomatic, and most of the patients with diabetes, they usually live with the disease for long before they are diagnosed. But the main complaint is usually blurred vision. That's when they start complaining that they are not seeing the way they used to see after they develop diabetes. When you examine, you can find either they have cataract or they have diabetic retinopathy. Then it's associated with a complete loss of vision, which is usually the worst complication that the patient can develop, secondary to either macular edema or retinal detachment or hemorrhages, or those exudates can lead to complete blindness.
Jina mimi naitwa Nicodemus Wachira Kenywa. Kutoka upande wa Karema.
Yes.
Huko mimi nimekuwa mgonjwa hiyo hospitali tangu ifunguliwe, na hata hapo beleni mimi nilikuwa nikienda kwa hospitali zingine. Sasa wakati hii ilifunguliwa, mimi nikaanza kuja hapa. Mimi nimesikia kuwa na ugonjwa wa sukari.
Yes.
Na mimi nafikiria hiyo ndio sababu ya hii kidonda sipone.
Yes.
Hata mimi nimeshafanywa grafting.
Yes.
Na wakati mimi nilipofanywa grafting ikapona, lakini haijapona kabisa. Yes. Ndio mimi naendelea kuja kuadresiwa.
Yes.
Hospitali ya Kenyatta imenishughulikia kutosha, sababu tangu mimi nje hapa sijaona makosa yoyote. Madaktari, wafanyikazi wote wananishughulikia kabisa. Jambo la mwisho ningetaka kusema ni hii hospitali.
Yes.
Ile madaktari wako wa kutosha, na watu wasiwe na shida kuja hapa.
Yes.
Wao wakija hapa na mtu atatibiwa vile hivyo.
Thank you. My name is Kennedy Okinda. I'm clinical nutritionist at Mwai Kibaki Hospital. Diet play a key role in management of diabetes. As we all know and understand, the origin of diabetes comes from the pancreas, which is the major organs that control blood sugar through the production of insulin. So the role of insulin is to help in uptake of glucose, and glucose, when I'm talking about glucose, is originating from the food that we eat from our diet. So if your diet is muchly composed of carbohydrates, the higher production of insulin will be felt in the body, and with that you find your body will not be able to catch up with the production of insulin and also the higher level of glucose in the blood system. Therefore, in that process, you find the sugars will be higher, more than the insulin that is being produced. So that play a key role in managing diabetic patients, because if you use a well-defined diet, it will be able to help control the blood sugar level. Healthy diet can help you prevent you from getting diabetes. Let me take it this way. If we are having an obese patient, that is their BMI is above 30 kg per meter square, those people are at a higher risk of developing diabetes. So what does this mean? It means that their body has accumulated a lot of fat, and this fat, when they are not taking enough diet, it's being now broken down to release energy. And sometimes the excessive fat production might also lead to issues to do with ketones. So for startup, for those people who have not been diagnosed with diabetes, they are encouraged to have a healthy diet. And when we are talking about a healthy diet, it's a composition of given groups of food, that we have carbohydrates in a very limited portion size. We have increase in vegetable and fruits. Then also we have a minimum amount of proteins that we take, because again the protein that we take also determine amount of weight we gain. If we take proteins that are also has fats, for example you take meat which has also had fat in it, therefore it means that your weight gain will be higher, and therefore that will expose you more to diabetes. Again, there are those people who have family history of diabetes. Okay, diabetes is there in there, is genetically involved in their family. So these are the higher risk group, and therefore they need to be more careful with the food, the diets they take, because if they are into the junk food, their risk goes higher, multiply compared to the people who doesn't have a risk of diabetes in the family. So that play a key role in prevention and also in the cause of diabetes.
Amaritho makwa njitagwo Peter Maina Murithi, ngoragwo ndi clinical officer in charge thĩinĩ wa thibitarĩ ĩno ya Gĩcice Health Center. Thibitarĩ ĩno yambĩrĩirio tene mwaka wa 1970, ũguo nĩ kuga 1970, na kuma hĩndĩ ĩyo thibitarĩ ĩno nĩ ĩkoretwo ĩgĩthiĩ na mbere. Thĩinĩ wa thibitarĩ ĩno nĩ twambĩrĩria kũnyitanĩra na thibitarĩ nene ya Mwai Kibaki Hospital ĩrĩa ĩkoragwo Othaya, na nimerĩga gũka gũkũ thibitarĩ ĩno mwaka wa 2019 na magĩtũhe medical camp yarĩ njega mũno, na andũ nĩ meyumĩrĩtie na njĩra nene mũno, na tũtiahotire kũrigita andũ acio marĩ othe. Na ta ũrĩa Mũgĩkũyũ augaga atĩ ndũgũ nĩ makinya, nĩ macokete rĩngĩ makauga nĩ megũtũrehera medical camp mũthenya wa Jumaa mweri 11, tondũ nĩguo thĩ yothe ĩgakorwo ĩgĩkũngũĩra World Diabetes Day. Na makuga nĩ mekwenda kũrehe free medical outreach thĩinĩ wa thibitarĩ ya Gĩcice, nĩgetha tũhote kũrora andũ arĩa tũkoragwo nao gũkũ nĩ ũndũ wa mũrimũ wa cukari ona gũteng'era thakame. Thĩinĩ wa thibitarĩ ĩno ya Gĩcice nĩ tũkoragwo twĩna ũtungata ngũrani, motungata maingĩ. Nĩ tũkoragwo twĩna mwena wa outpatient, nĩ tũkoragwo twĩna mwena wa laboratory, nĩ tũkoragwo twĩna maternity, na maternity ĩyo gũtirĩ kĩndũ na kĩmwe tũrĩhagia. Nĩ tũkoragwo twĩna mwena wa kiriniki ya ciana, na thĩinĩ wa motungata macio mothe andũ nĩ macokaga makaheo ndawa makainũka nacio. Na rĩu nĩ ũndũ wa mũthenya ũyũ wa World Diabetes Day ũrĩa ũgakorwo Friday mweri 11, thibitarĩ nene ya Mwai Kibaki Hospital nĩ merutĩire gũka kũrehe services ciao kũrĩ free medical camp, na nĩ maugĩte nĩ magakorwo mena arigitani aingĩ akuma gĩkĩro kĩa nurses, clinical officers, endocrinologists, ophthalmologists, ndagĩtarĩ wa magego, na nĩ makona andũ othe matekũrĩha oro nakĩ, na nĩ magakorwo marĩ na ndawa. Koguo ngenda kũgathĩria thibitarĩ ĩno na ngauga mathiĩ na mbere na kũnyitanĩra hamwe na ithuĩ na kũrehe services ciao gũkũ matũũra-inĩ, nĩgetha tũhote kũrigita arwaru aitũ. Njuge Ngai amarathime na mathiĩ na mbere na wĩra ũcio wao mwega.
Patients should make sure that the sugars are well controlled, and this will prevent complications such as retina issues, cataracts, and other complications like a diabetic foot or even heart failures or even cardiac arrests. So let's make sure that the diabetes is well controlled. Patients adhere to diet, patients adhere to medication, they do exercise, and they make sure that they take drugs as they are prescribed, and they get followed in the clinics.
You can live healthy with diabetes. For those who live around here, deo dhimo shukari wako umode.